Have you ever wanted to disappear? To turn off the lights and run away from the pains of reality?
Are you listening to me? I look into your eyes and I can't tell whether you're getting anything I'm saying.
While this notion is tempting, it is difficult to do with your mind alone. But imagine if something devastating happens to you, to the point where it is so unbearable that you no longer have any control over what your brain understands about the world. Suddenly, the lights go off, you're in the dark, and you don't even remember that life isn't supposed to be like this. There is no clearer-cut example of this phenomenon than the altered perceptions of children who suffer from chronic abuse before getting to grow up. Sigmund Freud's idea of repression offers insight into why children may block traumatic experiences from their conscious, but this theory cannot occur without the acknowledgement of complex post-traumatic stress disorder, a major disability that is currently unrecognized by the DSM-5. This video essay questions how the lack of clinical recognition for complex trauma, specifically the current failures in identifying its dissociative symptoms, is connected to the underdiagnosis of chronic abuse in children. Freud's theory of repression takes a new form when accompanied by the symptoms of complex post-traumatic stress disorder, or CPTSD. But what is this, and how is it different from just PTSD? While still classified in the DSM-5 as a trauma and stressor-related disorder, clinicians in recent years have started to consider PTSD to be a spectrum, where one end of its array is complex. CPTSD, as opposed to PTSD, is more commonly associated with dissociative patterns and behaviors, such as depersonalization and derealization, as well as feelings of hopelessness, worthlessness, and a false belief of self-blame, with these symptoms being attributed to repeated and/or prolonged exposure to trauma. Meanwhile, PTSD is on the other end more commonly associated with nightmares, flashbacks, and hypervigilant agitation, deriving from acute or isolated traumatic incidents. The distinction between these ends is to emphasize how the chronic components of CPTSD tend to ingrain their symptoms more internally, due to the trauma and its ensuing invalidation persisting over time. But considering how CPTSD is just now entering normal clinical practice, it's clear its long-term effects are manifested into symptoms that often go unnoticed. One theory as to why this is the fawn state of survival, often caused by perpetrators of abuse in children. Yet, the fawn survival response is the least researched of the other fight, flight, and freeze trauma responses. It is nonetheless commonly associated with CPTSD and can be understood as a dysregulation of the nervous system in which an individual enters a half-conscious state of mind where they essentially become a people-pleaser to a clinical degree. And this correlates with the fact that appeasement is an involuntary response as opposed to a learned behavior. Now, if this fawn response is activated by the nervous system in a patient with CPTSD, which could be by any authoritative figure or setting, it's possible they may disassociate into this people-pleasing mindset. So, in a clinical setting, if a doctor or trusted adult asks a child about their well-being, chances are they'll present themselves as perfect, assuming that's what someone would want to hear. And this would be a completely unconscious behavior, given their triggered state of mind is only attuned to pacify someone. This idea currently remains theoretical, however, and more research needs to be done on the fawn state of survival. So, now that we've established the potential cognitive complications in diagnosing CPTSD, we can discuss what's hopefully a bit easier to notice: body language. If child victims of abuse experience repression, a key component of why this is able to occur is dissociation. But before I explain dissociative amnesia and its potential ties to the body, I'm going to show a clip from the documentary Pretty Baby Brooke Shields that touches on what dissociation itself is. For context, Brooke Shields grew up in an all-adult world where she faced several traumatic incidents from her sexualization as a child star. And as she speaks, I really want you to pay close attention to her eyes and see if you can notice how present she is in the interview.
And when you had a chance to star her in this movie, you didn't hesitate a second. What did you see in her that is so special?
Well, you're talking about with somebody who's madly in love with this girl. So, it's very easy, the answer. I was in love with her before I met her.
How do you work with a Brooke Shield who is just barely, not quite 16, a youngster this age, and about a serious subject like lovemaking? How do you approach it? How did you work with her on that?
Well, she's quite a competent little young actress.
The physicality and the exploration of sexuality felt really dangerous to me. And I didn't trust the director to create a safe environment for me.
She was not giving exactly the impact that the scene requires. So it was there, and the camera was here, and the partner grabbed the toe and twisted it, and she screamed at, ah!
Stuff really kept grabbing my toe and like twisting it so that I had a feeling, so I had a look of sort of, I guess, ecstasy, but it was more angst than anything because he was hurting me. You know, his thing was, the look on your face, it has to be ecstasy. And I was like, I don't know what that is. I didn't want to appear stupid or untalented, so I just disassociated. It's like you, in an instant, zooming out, seeing a situation, but you are not connected to it. You instantly become a vapor of yourself around something that's happening.
Dissociation is a disconnection between the body and the mind, which protects both the body and the psyche, but at enormous cost. It's hard to feel in control of yourself because you're not feeling anything.
I was really shut down after that. I thought of myself as just the sort of the workhorse. They paid me, I did the thing, they sold it, everybody's happy. You know, it was transactional.
So, based on the clip, we can understand dissociation as being a disruption in the normal integration of consciousness. One theory for why this happens is where the idea of its ties to somatic symptoms, specifically ones of the nervous system, comes in. There is currently limited research that shows a co-occurrence of PTSD and dissociation with somatic symptoms, but what does exist exhibits clear evidence of them commonly presenting together, which brings us to the idea of somatic memory. I'm now going to show an interview from 2021 with Dr. Amani Duversula, who specializes in trauma and describes quite well how somatic memory, the idea that bodies hold trauma too, can be seen in patients when they enter a dissociative state.
Many clients over the years where we're doing the traumatic work and I start to lose them. I can see they're slipping and I'm like, come back in. I need you here. Because what I want to do, any of us who work in trauma, is we don't want their thinking about the trauma to become so dissociated, because then they're back in it. I want them in the room. You know, in fact, I'll almost make noise. Like, you're here, like,
Right.
we're talking about
I'm
this.
so getting this, yeah.
You know, right here, we're talking about it. It's not happening right now. And so it's really keeping them in the room. It's okay. I'm here. You're safe. No one can come in. But you're keeping them in the room. But that re-experiencing, it's a mental re-experiencing, but some people will literally describe, like, they feel like their body is in it again. They feel like they're being held back, and I'll even see that in their posture, like they're back, like they're being held. You know, what was done to them was being done to them. And so it's devastating. It's absolutely devastating.
And this isn't a conscious choice. This
No.
is a subconscious way to cope.
Right. I mean, trauma chops up the brain a bit, right?
Chops
You know,
up the brain,
it really, the brain is amazing in how it tries to protect itself, but there's more and more interesting work on how the brain isn't the only place that holds memory. Our bodies hold memory too.
So, she has clearly seen firsthand how, at least on some level, body language plays a role in a patient becoming dissociative. This idea, though still quite under-researched, has prompted theories of how trauma may be connected to idiopathic musculoskeletal disorders such as fibromyalgia and amplified musculoskeletal pain, or AMPS. Let's consider that fibromyalgia is recently being viewed more as a nervous system disorder, where both it and its juvenile counterpart, AMPS, attribute their symptoms to be from causeless pain signals. And now let's remember that any form of PTSD leads the brain to send unnecessary signals of muscle tension to activate a state of survival. And when you consider that with the polyvagal theory, which would tell you complex childhood trauma resets the nervous system to primarily operate in a semi-state of survival, such as the fawn response I spoke of, then it is very possible a patient with CPTSD would suffer constant muscle tension from this, which would directly contribute to both dissociative and chronic pain syndromes. I'm going to show you another clip now, this time from the documentary Quiet on Set, The Dark Side of Kids TV, with an interview from 2024 with Drake Bell. Drake Bell was, and trigger warning here, repeatedly sexually victimized by Brian Peck, a former dialogue coach on the kids channel Nickelodeon. Drake Bell was 15 years old at the time. During his interview, I want you to pay attention to his body language and see if you notice him developing a tenser posture the more he talks about what happened to him.
I was just trapped, and I had no way out. The abuse was extensive, and it got pretty brutal. Pretty brutal. I don't know, I really don't know how to elaborate on that on camera, really.
Whatever you feel comfortable or you think will help.
Why don't you do this?
Yeah.
Why don't you think of the worst stuff that someone can do to somebody as a sexual assault, and that'll answer your question. I don't know how else to put it. It was not a one-time thing. It was not a, oops, no, it is, I mean, I often look back at that time and wonder how in the world I survived. I remember all of the abusive events, but everything outside of that is very blurry to me, which is a bummer because I experienced a lot of great things in my life, in my career during all this time. But it was so overshadowed and ruined by what I was dealing with on the inside, that it made it really hard for me. I didn't feel like anyone knew anything.
And so, when you consider
The eyes, Chico. They never lie.
I feel like you can really see how he's in so much internal pain that went unnoticed for months on end. And if you look at the side-by-side comparison here of how he held himself before trying to share details of what actually happened to him, he starts off a lot more open. Legs half crossed, hands at his sides, making eye contact, shoulders relaxed. Then, after he tried to share what he went through, you can see he's got his legs fully crossed now. His hands are closed, he's looking away, his shoulders hunched, his lips are pursed. I mean, his body is practically tensing inward into himself, which, if you remember the body memory of Dr. Ramani that she's seen in her patients of physically re-experiencing trauma, it's clear he was getting a bit lost in his pain there. And I think his interview overall was respectful, if not the most informed. Drake Bell has since admitted he shortly went to rehab after doing this interview, which only goes to show how important it is to not just see the signs of someone being traumatized while it's happening, but also understand how to approach talking about these kinds of memories decades later. I'm going to wrap things up now with a bit of a positive note, in that what we can call experts by experience have found some relief in physical therapies. There's stuff like somatic shaking and breathing exercises that are all rooted in assisting the nervous system to rewire itself into a more integrated model where they can release their pain but also be more present in the moment overall. Here you can see this very brave woman showing her experience with somatic breathwork, which is a breathing exercise that focuses on activating the parasympathetic nervous system, which of course carries signals to have your body's systems function at their normal active state. And if you notice the level of twitching in her hand, as well as the general way her body is overall moving, it's not for nothing to note the physical parallels in traditional depictions of possession and exorcisms, as seen here in the 1973 classic, The Exorcist, which begs the question if these exorcisms described throughout history were really just maybe the painful rewiring of a person's nervous system from maturing enough to finally start to release some of their repressed trauma, especially since such body movements were typically associated to be about expelling evil, which is really still the right description. The crucial difference is the fact that this is not caused by demons from beyond. These are not mythical monsters doing this to these children. These are our friends, our teachers, our priests. These are people with constant access to children, and they are everywhere, and it's time they stop hiding in the haze that complex trauma creates. Doctors need to start questioning why a young kid has knock knees, rounded shoulders, or sway back posture, because it may all be indicative of pain a lot worse than sore joints. It's time they learn how to see past what a patient says and start to notice what is being hidden right in front of their faces. Thank you.